Let's start with something most men don't talk about, but probably think about more than they admit: testicle size. It's one of those topics surrounded by a strange mix of curiosity, discomfort, and misinformation. So let's clear the air. What's considered normal? Does size matter? And what should you actually be paying attention to? These questions aren't just rooted in insecurity. They can point to very real insights about your overall health. First, understand this: testicle size varies. Just like height, shoe size, or the shape of your nose, there is no single correct measurement. On average, a typical testicle is about 4 to 5 centimeters in length and 5 centimeters in width, roughly the size of a large grape or a small egg. But the important word here is average. It's not a target, it's a range. Some men have slightly smaller testicles, some a bit larger, and that's perfectly normal. One testicle may even be a little bigger or hang lower than the other. That's also totally natural and very common. What matters more than the actual size is what that size might be telling you over time. Think of testicles like biological barometers. They react to shifts inside the body. If your testicles have always been a certain size and they stay that way, great. But if there's a noticeable change, if one suddenly swells or shrinks, that's when you want to pay attention. It's not about comparison with others. It's about staying aware of your normal. Now, many people don't realize that the testicles play a central role in two major systems: reproduction and hormone production. They're not just hanging around for show. They are the body's primary producers of testosterone, and they're the factory floor for sperm development. So their size isn't just a random genetic quirk. It often reflects what's going on under the surface. That said, a slightly smaller testicle doesn't automatically mean low testosterone, and larger doesn't always mean high sperm count. But if there are sudden changes, especially if they're paired with other symptoms like pain, fatigue, or changes in sex drive, that's when you may be getting an early warning sign from your body. There's a psychological aspect to all of this, too. For generations, men have internalized the idea that bigger is better when it comes to their bodies, especially below the belt. But in medical reality, that thinking is outdated and unhelpful. What we're really concerned about isn't the aesthetic or even the absolute size. It's symmetry, consistency, and changes over time. So, if you're thinking about what's normal, stop comparing and start observing. Get to know your own baseline. An important part of that is self-examination. Not enough men do it, and yet it's one of the simplest, most effective ways to keep tabs on your health. It's not complicated. Once a month, in the shower when the skin is relaxed, take a few seconds to gently feel each testicle between your thumb and fingers. You're checking for lumps, unusual firmness, or sudden size differences. This isn't about being paranoid, it's about being proactive. The earlier you notice something unusual, the better chance you have of addressing it before it becomes serious. And let's talk comfort here, because a lot of men don't want to even look, let alone touch, out of fear they might discover something wrong. But knowing is always better than not knowing. Getting familiar with your own anatomy is a form of control, not anxiety. It's confidence, not fear. There's also a myth floating around that bigger testicles equal higher virility. The truth is a little more nuanced. While testicle size can be related to sperm production, it's only one piece of a much bigger puzzle. Quality, mobility, and genetic factors all play key roles. And when it comes to testosterone levels, function matters more than size. You could have a pair of testicles that are average or even slightly below average in size and still have perfectly healthy hormone levels. So again, it's not about visual judgment, it's about biological performance. All of this is to say, don't obsess over centimeters and measurements. Instead, get comfortable with understanding your own body. If your testicles have always been on the smaller side, and everything else is functioning just fine, energy, mood, libido, fertility, then there's no issue. The same goes for those with larger testicles. What we care about is change. What we care about is function. And most importantly, what we care about is you taking responsibility for knowing what's normal for your own body. So if you've ever wondered what your testicle size says about you, the answer isn't found in a ruler. It's found in awareness. Now that we've established what's normal when it comes to size, let's dive a little deeper into what that size might actually mean. Because while it's important not to obsess over dimensions, it's equally important to recognize that testicle size can give us clues, real biological signals, about what's going on with your hormones, especially testosterone. And testosterone, as you know, plays a central role in everything from your energy levels and mood to your muscle mass, libido, and even the health of your bones. Testicles aren't just along for the ride. They are your primary source of testosterone. So when we're looking at unusually small or significantly enlarged testicles, we're not just talking about something cosmetic. We're potentially looking at the body's hormone engine, either idling too low or working in overdrive. And that matters. Let's start with smaller than average testicles. When testicles are abnormally small, much smaller than what's typical for that person, it can be a sign of something called hypogonadism. That's a condition where the body doesn't produce enough testosterone. And that low testosterone can lead to a whole chain reaction of symptoms: fatigue, reduced libido, difficulty building muscle, depression, even infertility. The size of the testicles in this case is more of a red flag than a root problem. It's your body's way of saying something isn't functioning as it should. Now here's where it gets more interesting. Some men might have smaller testicles and still feel just fine. No major symptoms, no noticeable drop in function. That's why we never jump to conclusions based on size alone. But if a man walks in saying he's been feeling more tired than usual, having trouble concentrating, or experiencing erectile changes, and he also has unusually small or shrinking testicles, that paints a clearer picture. It suggests we may need to take a closer look at his hormone levels, particularly testosterone, and figure out what's happening internally. On the flip side, significantly larger testicles, or one that suddenly swells, can also tell a story. In some cases, it's linked to a condition where the testicles are producing too much fluid or are under strain. It might be a varicocele, which is essentially like varicose veins in the scrotum. That can lead to swelling, and over time, it can also affect testosterone production and sperm quality. Or in more serious cases, sudden enlargement can even signal a tumor or an infection, both of which demand immediate attention. The bottom line is this: significant change in size up or down can reflect a shift in hormone production, and that's worth understanding. Another key thing to know is that hormonal health isn't just about sex. It affects your brain, your body, and even your emotional well-being. Testosterone helps regulate your mood, supports heart health, and keeps your bones strong. So if your body is quietly reducing its testosterone output, you might not notice it right away. Maybe your workouts don't feel as productive. Maybe your patience is shorter, or your motivation is lower. You might not tie those things to your hormones at first, but they're all part of the same system. That's why paying attention to something as simple as testicle size and understanding its connection to hormone levels can offer an early advantage. Now, let me be clear, size alone doesn't diagnose a hormone issue. We always follow up with blood work, with conversations about symptoms, and with a broader assessment of health. But when you're trained to spot the signs, the testicles can act like an indicator light on a dashboard. They're giving you a signal that it might be time to lift the hood and take a look underneath. It's also worth noting that lifestyle plays a huge role in hormonal health. Diet, sleep, stress, and exercise all contribute. So when we see smaller testicles and lower testosterone levels, one of the first things we examine is daily habits. Is the person getting enough rest, Are they under chronic stress? Is alcohol use a factor? These things influence the body's ability to produce testosterone and can literally reshape the organs responsible for doing so. We can't talk about hormone health without mentioning puberty and development either. If someone never fully developed during adolescence, if the voice didn't deepen, facial hair didn't come in, and testicle growth was minimal, that can suggest the body never ramped up testosterone production like it should have. In those cases, addressing hormone levels early can dramatically improve quality of life, even later in adulthood. So again, it's not about fixating on size, but about understanding what changes in size may be pointing to. When testicles are smaller than usual, or if they seem to shrink over time, we consider whether the body might be running low on testosterone. And when they're larger or change suddenly, we consider whether there's stress, swelling, or another underlying condition. These aren't just physical observations, they're functional insights into your hormonal health. And that's why the size of your testicles isn't just trivia. It's a signal, a snapshot, a silent messenger from your endocrine system that can help you catch an issue early and take control of your health before it spirals. Now let's shift the focus to something that's often top of mind when testicle size comes up in conversation: fertility. For many men, this is where curiosity about testicular size turns into genuine concern. Whether it's about starting a family now or just thinking ahead to the future, the question is usually the same. Does the size of my testicles say anything about my ability to have children? The short answer is, it can, but like most things in medicine, it's not the whole story. Testicles are the body's sperm-producing factories. Inside, there are tiny structures called seminiferous tubules, where sperm are developed, matured, and stored. Now, generally speaking, larger testicles tend to have more of this internal architecture, which can mean a greater capacity for sperm production. So yes, in many cases, there's a loose correlation. Men with larger testicles may have higher sperm counts. But, and this is important, bigger doesn't always mean better, and smaller doesn't always mean infertile. There's much more going on beneath the surface. We've seen men with average or even slightly below average testicle size who have perfectly healthy sperm profiles. Count, motility, morphology, all looking great? On the flip side, we've also seen men with larger testicles who struggle with fertility issues because the sperm quality is poor, or because the testicles are being impacted by something like AIDS, varicocele, an undiagnosed infection, or even lifestyle factors like excessive heat exposure or substance use. So again, it's not just about size, it's about function. That's why we look at testicle size as one piece of a bigger fertility puzzle. If someone's struggling to conceive and they also have very small testicles, especially if it's accompanied by low libido, reduced muscle mass, or fatigue, we start to consider whether a hormonal issue could be affecting both testosterone levels and sperm production. In many of these cases, a semen analysis and hormone testing can offer clarity. We're not guessing, we're looking for patterns that tell us where things might be out of balance. Sometimes, what we discover isn't a permanent issue. Stress, sleep deprivation, poor diet, or heat exposure from things like hot tubs or laptops on the lap. These can all reduce sperm count temporarily. So if testicle size is slightly on the smaller side, but everything else checks out and lifestyle habits are on the healthier end, there's often no need to worry. In fact, we often see improvement in sperm parameters when those environmental factors are addressed. The body has an incredible ability to rebound when given the right conditions. Now, what about cases where one testicle is notably smaller than the other? That can also raise questions about fertility, especially if the smaller testicle has been that way since puberty or after an injury. Sometimes it's simply a result of natural variation. Other times, it might be the result of trauma, infection, or a condition like testicular torsion in the past. Something that cut off blood supply for a period and caused that testicle to atrophy. In these cases, as long as the other testicle is healthy and functioning well, fertility might still be perfectly intact. One fully functioning testicle can do the job of two when it comes to making sperm and testosterone. Another thing that sometimes surprises people is how much sperm quality matters compared to quantity. You could have a high sperm count, but if the sperm aren't moving properly, or they're misshapen, or they can't reach and fertilize the egg, it doesn't lead to pregnancy. So while testicle size might give us a rough idea of how much sperm is being produced, it tells us very little about how well that sperm is doing its job. That's why semen analysis is such a critical step in any fertility conversation. It gives us specifics. It helps us move beyond guesses and assumptions. And then there's the emotional side of this. For many men, discovering a potential fertility issue can feel like a personal failure. It can stir up shame, doubt, and a lot of quiet suffering. That's why I always emphasize this point. Fertility is a medical issue, not a character flaw. It's something that can be investigated, understood, and in many cases, treated or improved. Your value as a partner, as a man, as a person, it's not measured by a sperm count or a testicle measurement. And the more we talk about these things openly, the more we remove the stigma that keeps men from seeking help in the first place. So if you're ever wondering whether the size of your testicles is affecting your fertility, know that it's a reasonable question, and one that deserves clear, compassionate answers. Because while testicle size can offer a few clues about sperm production, it's only part of the picture. What really matters is how all the systems are working together: hormones, lifestyle, anatomy, and timing. And that's why awareness, not anxiety, is your most powerful tool. So far, we've talked about what's normal, what size can suggest about hormonal health, and how it ties into fertility. But now we need to cover something just as important when it's time to be concerned, because while variation in testicle size is often harmless, there are certain changes or symptoms that absolutely should not be ignored. Your body has subtle ways of communicating with you, and when it comes to your testicles, those changes are rarely random. They're usually signals, and knowing when to listen can make all the difference. One of the biggest red flags is sudden or gradual shrinkage. If one or both testicles begin to shrink over time, that's not just a cosmetic issue. It can be a sign that the tissue inside is no longer functioning as it should. This might be due to a decline in testosterone production, but it can also result from testicular atrophy caused by underlying issues like hormone imbalance, injury, varicocele, or even long-term use of anabolic steroids. Shrinking testicles are a warning sign. They're the body's quiet way of telling you something's not right here. But the opposite is true as well. If a testicle suddenly swells or becomes noticeably larger, that should trigger concern too. One potential cause is fluid buildup, sometimes due to an infection or inflammation like epididymitis, which can come on quickly and cause pain and swelling. In other cases, an enlarged testicle might be painless, and that's actually the bigger concern. A painless lump or enlargement can sometimes point to testicular cancer, which often develops without much discomfort in the early stages. And that's what makes awareness so crucial. Pain doesn't always accompany problems. Sometimes the most dangerous issues are the quietest. Another major signal to watch for is the presence of lumps or firmness that wasn't there before. Most lumps in the testicle aren't cancer, but every lump deserves to be checked. Early-stage testicular cancer is highly treatable, even curable in many cases, but only if it's caught early. And too often, it's missed because men either ignore the signs or feel embarrassed to talk about them. But if you notice something unusual, anything new, firm, or fixed in place, that's your sign to take action. Don't wait to see if it goes away. Don't talk yourself out of it. just get it looked at. Pain is another clear signal. Testicular pain that comes on suddenly, especially if it's sharp or severe, can sometimes indicate testicular torsion. That's a twisting of the spermatic cord that cuts off blood supply to the testicle, and it's an emergency. This isn't something you sleep off or wait out. It requires immediate medical attention to prevent permanent damage. Pain can also come from infection, trauma, or inflammation, all of which require proper evaluation and care. Pain is your body's alarm system. It exists to push you to act. Temperature sensitivity, heaviness, and aching can also be subtle warning signs, especially if they're chronic or seem to worsen over time. Sometimes men describe a dull ache in the groin or a dragging sensation in the scrotum. This can be related to varicocele and enlarged veins in the scrotum that can affect both comfort and fertility. While not usually dangerous, they're worth checking if they're causing ongoing discomfort or contributing to other symptoms. It's also important to look beyond the physical signs and think about the patterns. Have you noticed a drop in energy, persistent fatigue, or emotional changes like irritability or depression? Are you seeing a decrease in sex drive, performance issues, or trouble concentrating? If these are paired with any physical changes in the testicles, that's when we start to look at a bigger hormonal picture. Sometimes the testicles are the first place you notice a shift, but the impact is being felt throughout your entire system. Now, none of this is meant to scare you. It's meant to empower you, because your testicles aren't just reproductive organs, they're messengers. And when they start to change, they're not doing it quietly for no reason. They're telling you something. And your job is to notice, to stay informed, and to respond early rather than late. That's why I always recommend regular self-exams. It doesn't take more than a minute or two once a month. It's a chance to check for anything new, anything unusual, anything off. Do it in the shower when the scrotal skin is relaxed. Gently roll each testicle between your fingers and feel for consistency, shape, and size. You're not looking for problems, you're just getting familiar with your normal, so that if something ever changes, you'll recognize it right away. The most important thing to remember is this: your health is your responsibility. Nobody else lives in your body. Nobody else will notice what you ignore, so if something feels off, speak up. Don't wait, don't rationalize. Don't assume it will fix itself. The earlier you respond, the more options you have, and the better the outcome will be. Because at the end of the day, the size, shape, and feel of your testicles aren't just physical traits. They're one of the most honest ways your body talks to you.